Hello, I'm Dr. Candace Dye, an associate professor within the Department of Pediatrics, the Hersink School of Medicine at UAB, and Children's of Alabama. We are talking about COVID-19 today. So COVID-19 is a respiratory disease caused by SARS-CoV-2, discovered in 2019. The virus spreads through respiratory droplets and small particles produced when an infected person coughs, sneezes, or talks. Symptoms that people experience include fever, cough, difficulty breathing, headache, congestion or runny nose, fatigue, new loss of taste or smell, nausea, vomiting, and diarrhea. They are contagious from approximately 2 to 10 days after being exposed to the virus and continue to be contagious for up to 14 days. Treatment, you can use cough and cold medicines if the child is old enough, use of fever reducers if they have fever. You need to stay well hydrated with plenty of clear liquids. Some patients may qualify for antiviral medications, and this is something that is constantly being researched and updated. And then, of course, if the patient is having difficulty breathing or not waking normally, seems confused, then you need to seek medical attention. How can we prevent COVID-19? So, practicing good hand hygiene, wearing a mask when there's a chance of exposure, and then, of course, vaccines for COVID-19 and including boosters on schedule. And like any other vaccine, these don't prevent infection, but it greatly reduces your risk of severe illness if exposed and infected. Exclusion criteria for schools and readmission recommended criteria include students and staff exposed to COVID-19 no longer need to quarantine unless they are in high-risk congregate settings, but they should wear a mask for 10 days and get tested at least 5 days after an exposure. If they are infected with the virus, then they should stay home for 5 days is the current recommendation and isolate from others. And then when they are able to return, they need to continue to wear a mask for 5 more days.